All right, we're going to move to a Zoom session, I hope, that we have Kerri there, who's going to give us an update on TB and comorbidities and an update from the WHO. Awesome. Thank you.
Okay, can you hear me? Yes, I can hear myself, so that's good. Well, good afternoon, everyone. Nice to talk to you again, and I hope you've had a good day and a good program today. It was very interesting to hear Steve's presentation, so thanks, Steve. And yeah, maybe just before I start the talk, as Steve mentioned, we do have a GDG, or a Guideline Development Group, meeting coming up on the management of children and adolescents. There's a bit of an echo. I'm not sure if others can hear that or if it's just me. Is it just me? That's a bit better, actually. Oh, that's a lot better. Thank you. Yeah. So as Steve mentioned, we do have a Guideline Development Group meeting coming up. It actually starts on Monday on the management of TB in children and adolescents. And I think that decentralisation question, apart from, the other questions, is quite important. And I hope that, we have a reasonable body of evidence. The evidence is a bit scant, but I hope that we can say something about that after this Guideline Development Group meeting. But this afternoon I've been asked to talk about tuberculosis and comorbidities. So I'm going to provide an update from WHO, and this is really sort of a policy-focused presentation, but of course in all of the policies there are research priorities and research gaps. Some of the research gaps are of course quite big. So if you're interested in sort of research priorities, I encourage you to look at the guideline documents, and they always have a section on the research gaps which have been identified during the Guideline Development Group meetings. So I don't think I really need to tell this audience too much about the NTB strategy, but just really to emphasise that Pillar 1, which is about integrated patient-centred care and prevention, does emphasise in component C about collaborative TB-HIV activities and the management of comorbidities. And I think it's probably quite appropriate that this is in Pillar 1, which is about integration of services and patient-centredness and prevention. So I think this is really a very appropriate place to house TB-HIV and comorbidities. Now, in terms of comorbidities specifically and understanding the key drivers of the TB response, I think many of you will probably have seen these kind of figures. So now in the Global TB report, we report on 5 sort of risk factors / comorbidities and have tried to sort of determine population attributable fractions. Now, of course, population attributable fractions have some inherent sort of concerns, I guess. But in terms of those fractions, you can see from this table that undernourishment is probably the biggest risk factor that contributes to the global TB epidemic, with 19% there and about 2.2 million cases attributed to undernutrition. Of course, undernutrition and malnutrition is a huge problem in certain countries, and India does contribute a large proportion of this burden. And then in terms of the other risk factors and comorbidities, you can see that alcohol use disorders, HIV infection and cigarette smoking contribute roughly the same attributable burden, sort of about 700,000 cases, and then diabetes a bit less, 350,000. And of course, there's considerable variation among the countries regarding the relative contribution of these 5 factors. And this is shown a little bit in the next slide. So as mentioned, we do publish on these 5 risk factors, and I apologise that this graphic is a little bit hard to see, but you can see it in the Global TB report around page 160, I think. But for the 30 high burden countries, we're also publishing the contribution of these 5 risk factors. So you can see undernourishment is the risk factor in green there at the bottom, and that many countries have a large burden of TB attributable to undernourishment. But of course, this varies quite a lot between the countries and the settings. And I'm just thinking about our region. So you can see Papua New Guinea there at the bottom of the slide, Vietnam, etc. So if you want to see those, they're in the Global TB report. Now, in terms of TB and comorbidities, we have had some high-level meetings, of course, on both HIV, TB and non-communicable diseases. So non-communicable diseases was also held in 2018, the same year that the TB-HLM was held. And these sort of high-level commitments, I guess, really do emphasise comorbidities and their management. And all of them state that we need to strengthen integrated care, which again relates to Pillar 1 of the NTB Strategy, so that we need to strengthen integrated care of TB, HIV, NCDs and the related risk factors, including malnutrition and mental health disorders. And in fact, there is another UN high-level meeting on HIV coming up on the 8th of June, 8th to 10th of June. And I'd just like to sort of thank Warwick and Ben and Guy and others for their efforts. Oh, sorry, we've got some background. Yeah, and others, because we're hoping to organise a side event on HIV-associated TB at the HIV high-level meeting. But those high-level meetings just really emphasise the high-level commitments to TB and NCDs in particular, and HIV. Now, in terms of WHO guidance on TB and comorbidities, there are a number of guidance documents, and I'll talk a bit more about some of these shortly. But of course, there's a sort of a suite of documents on TB, HIV, including some that have come out this year. I'll talk a little bit more about that in a moment. We do have guidelines and recommendations on TB and malnutrition, which came out in 2013 from the Global TB Program, and then 2019 from another department. We've got recommendations on TB and diabetes, which were released in 2011. We've got recommendations on TB and mental health, TB and viral hepatitis, and TB and tobacco and lung health more broadly under Practical Approach to Lung Health. Now, in terms of, I just thought I'd show some of the newer recommendations on TB and HIV specifically. So these recommendations have come out just in the last few months. I realise that some of you may have seen these, others may not, but these recommendations actually just came out in March. So there are new recommendations for screening for TB among people living with HIV, and they're on the right of the panel there. Let's go to the next slide. And in particular, probably some of the novelties are that there is now a recommendation among adults and adolescents, so it's not the younger children, obviously, but CRP can be used to screen for TB disease using a cutoff of 5 milligrams per mil, and that chest X-ray can be used to screen for TB disease. So there are quite a few new recommendations on new tools for screening for TB among people living with HIV. And they're contained in sort of that little brown guideline there that's circled in red, which is the new screening guidelines, which came out on World TB Day. Also, there is another new recommendation which came out from the HIV department on the start of ART. So that's at the bottom left-hand panel of the slide there. So that recommendation really states that ART should be started as soon as possible, but within 2 weeks of initiating TB treatment. And that's regardless of CD4 count among people living with HIV. And that is a strong recommendation for adults, adolescents, children and infants. So they're probably the latest recommendations on TB and HIV in particular. Now, I think many of you will be quite familiar with this policy. This document has been around for a while. So WHO has a policy on collaborative TB-HIV activities. And this document really is not just about the sort of formal recommendations, but it's really about establishing and strengthening mechanisms to deliver integrated care. And I think this is one of the sort of key messages with TB and comorbidities, that there needs to be integrated care. So we have the formal recommendations, perhaps on screening or treatment or diagnosis, but there's also this fairly strong emphasis on integration of services and ensuring that people can access, some form of HIV service via the TB clinic, for example, and that these services are integrated. Now, we also have a collaborative framework for the care and control of diabetes. And again, this has some recommendations about bidirectional screening, etc. but it also really sort of emphasises the need for collaborative services, I guess integrated services, whatever you want to call them. And this is something actually that we're wanting to emphasise a bit more, and I'll talk about that in the coming few slides. And then finally, we do have recommendations on nutritional care and support. I think people don't know about these recommendations so much, so we're trying to sort of improve the visibility, I guess, of the nutritional care and support recommendations, particularly in countries where this may be needed. But these guidelines contain recommendations on nutrition assessment and counselling, the management of malnutrition or undernutrition, and also micronutrient supplementation. And maybe for this audience, you might be interested to know that our Chief Medical Officer, Paul Kelly, was actually a person who was instrumental in developing these guidelines in particular, because he had a very strong interest on nutritional care and support a few years ago. So it's good that his contribution is there. Now, just thinking about where we might sort of move to in the future in terms of TB and comorbidities, and in terms of sort of recommendations from WHO more broadly. So I think it would be fair to say that the TB-HIV policy has been successful, and that is evidenced in the data, although there are some data gaps, of course, and there are some areas where collaborative activities need further improvement. But generally speaking, I think this policy has been quite successful. It's had very strong branding. It's had very strong support with external stakeholders, I think. It's had frameworks to really push forward the TB-HIV agenda, including research. So you can see here we've got a specific document on priority research questions. It has some monitoring and evaluation indicators, which I think really drive some of the scale-up and response, that there are indicators on which to report. And the recommendations have also been mainstreamed. And the reason for mentioning the success of this policy is that we are trying to do some other work to kind of put forward collaborative activities on TB and comorbidities more broadly, but building on the success of this policy, I guess, and learning the lessons from this policy. So in terms of what we're doing in the future, so as I mentioned before, we have all of these kind of various guidelines and documents on TB and comorbidities. We're currently working on bringing sort of those recommendations together, I guess, in one document. And we're developing a framework for action on TB and comorbidities, and we're currently going through the process of country consultations and focus group discussions, and talking to countries about what have been some of the barriers, what have been some of the enablers with regards to TB and comorbidities. And I think it's probably fair to say that uptake of comorbidity recommendations outside of TB-HIV has been lagging, it's been slow. And I guess it's quite specific to certain countries sometimes. So yeah, as we know, TB and diabetes is a particular problem in our region. So there's been quite slow uptake of some of these recommendations, and we're trying to sort of conduct some focus group discussions to find out why. So this framework for action on TB and comorbidities will take a similar sort of structure to the TB-HIV policy. So it will include the latest recommendations and advice on things such as in box B there, finding and treating TB among people with comorbidities, in box C, prevention, and then in box D, finding and treating the comorbidities among people with TB. But I think, again, sort of a strong message will be that there needs to be some mechanism for integration or collaboration between services, and that is really needed to sort of manage TB and comorbidities more broadly. So, as mentioned, we're in the process of developing this framework for action on TB and comorbidities. We will also be developing, we're also looking at our recommendations and seeing if they need updating. So I might just go to the next slide actually, because I think that's here. Yep. So in terms of the plans to sort of take forward the work on TB and comorbidities, as mentioned, we're developing a framework for action on TB and comorbidities in collaboration with the regional offices and the country offices and other stakeholders. We're also going to be consolidating all of the TB-HIV recommendations into one document. So that'll be a consolidated guideline on TB-HIV. because it's at the moment it's in various documents, which is potentially difficult for people to find. We're developing some monitoring and evaluation indicators that will go beyond TB-HIV. So there may be some indicators for TB diabetes, for example, or TB and malnutrition. We've just commissioned a scoping review on to look at the evidence on TB and diabetes, malnutrition and mental health in particular, because those guidelines are a little bit outdated now. So we've just commissioned a scoping review to look at the evidence and to see if there is new evidence on any of the topics that are of interest. And we anticipate that we'll have updated policy guidance on TB and comorbidities in the next couple of years, so 2022 to 2023. Now, I just got a few slides to conclude, but in terms of our recommendations more broadly, so we'll have, of course, we have TB-HIV recommendations, we've got some on other comorbidities, and we're planning to update those as well. But in terms of all of the global TB program's recommendations, so diagnosis, treatment, screening, prevention, we're also launching what's called a knowledge sharing platform, and that'll be an online site, basically, where people can access all of the latest global TB program guidelines, as well as other resources that are sort of designed to facilitate the uptake of WHO recommendations. So that website will include all of the guidelines from the global TB program, and we're trying to consolidate guidelines where possible, so there's not sort of 5 or 6 documents, but they're all in one document. We're also going to have some implementation guidance or operational handbooks, and they're really designed to sort of help countries implement some of the recommendations. And then we'll have a library of training materials, and the timeline for that has been November last year until now, until May. So this is what the knowledge sharing platform will look like. There will be a phone version as well, a mobile phone version, and I've just provided the link there. And as I said, it will contain the guidelines with the formal recommendations from guideline development groups, the operational handbooks, which are more about implementation, and a training catalogue. Now, as part of this knowledge sharing platform, the recommendations will be searchable. So this is just sort of a brief screenshot to show you. So if you're looking for the latest recommendation on the start of ART among people living with TB and HIV, then you can search this website, and there's been a whole lot of mapping done to try and map out all of the recommendations and group them in the appropriate areas. So this is called the Rec Map for short. But this will be a searchable site, so you can search, you know, if you're interested in children or adolescents or HIV or treatment, screening, whatever it is, you'll be able to search for recommendations. And you can see this is how the site will be structured. So it'll be prevention, screening, diagnosis, treatment, and finally vulnerable populations, comorbidities, and people-centred care. And as mentioned, there'll also be a training catalogue, which is designed for use among people working in primary care or people who are training people in primary care. So that will also be part of this knowledge sharing platform. And then finally, for anyone who's interested in this knowledge sharing platform, we have a live demonstration coming up on Thursday, 3rd of June. So if you wanted to register for that, I've just included this last slide. And I think that's it. Thank you very much. Thanks.
Thanks, Kerri. That was excellent, and we'll get those links, make sure they go up on the CRE website. Are there any questions for Kerri? Comments? Anyone?
Thank you. Vitaly Sinchenko, University of Sydney, and ICPMR Westmead. Thanks, Kerri, for this wonderful overview. I suppose we've spent earlier today a bit of time brainstorming the issues of COVID and TB. It's not a comorbidity as such, I suppose, necessarily, but certainly it's an issue that will have long-lasting impact on TB control programs internationally. I'm just wondering how much appetite WHO would have to explore this co-occurring problems and and the impact and mitigating strategies? Thanks.
Yeah, no, thank you, Vitaly. We do have a strong interest in COVID and TB. I can hear the echo again, but I'll just keep going. I think it's... we do have... Oh, that's better. Thank you. Yeah, we do have a strong interest in COVID and TB. We have a focal point within the Global TB program for COVID, which is Dennis Falzon. I think many of you know Dennis. And we've been collecting monthly data from a subset of countries on sort of TB notifications to try and determine the impact of COVID on TB services. That's one thing, I guess. And I think that sort of demonstrated that we can actually do monthly surveillance, which has been quite useful even beyond COVID. But in terms of sort of COVID and TB as sort of perhaps comorbid conditions, for want of a better word, yes, there is strong interest in this as well, and we're actually just applying for some funding for that, and to think about sort of COVID and post-TB lung disease, or TB and post-TB lung disease, and TB and sequelae as well more broadly. So it's certainly something that we're interested in. And Dennis Falzon is the focal point for COVID and TB if anyone wants some more information.
Questions for Kerri?
Question about language or something?
Sorry, Kerri, it's been just that you introduced the question, but just to ask where this would resort within WHO, clearly, so TB-induced comorbidity, so the chronic lung disease issue, does it have a home in WHO, or what is the vision in that space?
Yeah, no, it's a very good question. It does have a home, firstly, and I think that's in the Global TB program at the moment. Although, of course, we have other departments who work on lung disease and chronic lung disease, so we're collaborating with them. So I think the first thing is that, yes, it does have a home and it's in the Global TB program. In the unit I'm working in, we've just had a new unit head. Oh, thank you, that's better without that echo. In the unit that I'm working in, we've just had a new unit head appointed, I think as many people know, Faro Mavunga, and we will be taking forward a body of work on TB and sort of sequelae more broadly. So obviously the post-TB lung disease are included in that, but of course there is a broader agenda of sequelae more broadly. So not just lung sequelae, I guess is what I'm saying. So yes, does that answer your question, Ben? Yeah.
Cool. Thanks very much, Kerri. So we'll just thank Kerri again. And
Thank you.